and we will get back to you. So why don't we go ahead and start. Again, I'm Dr. Mary Wendell. I will be joined by Sarah Maresco, our nurse practitioner, shortly. We're going to be covering a fair amount of information, which is interesting. Again, I think minoxidil is a very interesting topic, and I think it's a treatment that has been largely ignored with newer treatments coming along, but shouldn't be. I'm going to give you just a little bit of background about hair loss and the anatomy of it, because it's going to come into play when Sarah talks about how these treatments work and where they work. We'll clarify what products are available, who should use it, who shouldn't use it, what the expectations should be. The growth with which minoxidil has changed over the last 30 to 40 years is very interesting. A lot hasn't changed, but a lot has changed. So hopefully we'll be able to touch on all the questions that you have, and you'll walk away with more information. Again, I'm Dr. Mary Wendell, Medical Director of Medi. Tresse. Sarah Maresco is our nurse practitioner. Okay, we start all of our webinars with a little update because things are constantly changing, and on a weekly basis, in fact, in the office. And we are all open, which we're happy to say. We have very strict safety protocols in place to protect you as well as our staff. We limit the number of appointments, we stagger them. So if you come to the office, it's a good chance you won't even see anybody else in the office other than the staff. You won't see other patients. We do use air purifiers, we do extensive cleaning. Again, we're very, very careful, and we're very proud of the fact that we've been able to stay open. Having said that, I know there are people who are still not totally comfortable coming out yet. So we still have phone and video appointments available. When people do video consultations, we do eventually encourage people to come back in so we can do that very close examination, which can only be done in person, but we can oftentimes get treatment going, even with a video consultation. So we do a pretty thorough history and talk to you at length, and even with just a screen, we can get a pretty good amount of information. The other thing is we can always ship products to you. If you have any interest, we do have an online store. So feel free, if you're interested in anything, we can ship it to you at anywhere. So. Okay, just a brief discussion about female hair loss. For those of you who have joined us before, you've heard this before, I apologize, but it's important for our new people signing on to have some idea of what we're talking about when we discuss treatment. So just briefly, again, this is important when Sarah talks about how minoxidil works. There are actually 3 phases of the normal hair life cycle. For each individual hair follicle, there's a separate life cycle going on, independent of the hairs around them. An anagen is the growth cycle, and this is where we like to stimulate. This is where treatment is focused, to try and get the growth cycle to be prolonged and the hair follicle to be more healthy. As the hair grows, and that can be in the order of anywhere from 2 to 6 years. And in fact, those of you who have had little girls know that their hair can grow all the way down past their waist without much difficulty. Their growth cycles are incredibly long. Unfortunately, that growth phase shortens over time as we age. That's why there's a significant amount of variability. The catagen phase is when the hair stops growing and it's just kind of resting. It's sort of a transitional phase. Treatment really doesn't affect the catagen phase. The telogen phase is the resting phase, which is as it's getting prepared to fall out, the hair pulls away from the follicle, and the actual hairs then fall out, and there's another resting phase before a new hair will start to come in. And so treatment is primarily focused on the anagen phase, and by doing so, sometimes we can decrease the time that takes to get to that shedding phase. Again, over time, genetics and underlying illness and a whole lot of other factors, the hair cycle can shorten, and treatment is also focused on how to lengthen that so that you can hold on to your hair longer. The types of hair loss that you may hear about today include androgenic alopecia, which is the most common. It's what we see most. It's female pattern hair loss. It's genetic and hormonally based. Telogen effluvium is excessive shedding. So too many of the hairs are hitting that telogen phase and falling out faster than they should. Traction alopecia is hair loss as a result of very harsh hair care practices, which literally pulls the hair out of the follicle when it's not ready. It's a traumatic loss of hair. Alopecia areata is an immune disease where the hair follicles are inflamed and the hair falls out. Treatment is different for all of these. There is some overlap. We're also seeing, and I say fortunately because there's more survival with cancer treatments these days, and we're seeing a fair number of post-cancer hair loss, which is about, it's interesting, up to 30 to 40% of women in particular who most of the female type cancers like breast cancer, ovarian, uterine cancers, they use the type of chemotherapeutic agents affect hair significantly. So we are now treating women who have post-cancer hair loss. Scarring alopecia is a tough one. You won't hear as much about that today. We're seeing more of it. Again, it's an autoimmune disorder, which can be very aggressive. The most important piece of treating hair loss in women, even men, is getting a good, thorough evaluation. And that means a good, thorough medical history, a hair loss history, family history is critically important. At Medi Tresse, we have you fill out extensive paperwork so we have a good baseline before we even see you. At the appointment, we do a careful exam, including trichoscopy, which is a magnification of the scalp, and we can see what's going on with the hair follicle. Oftentimes, we do recommend blood work because with women, there are a lot of things that can affect hair loss, including hormonal things like thyroid, estrogen, testosterone. All those things play a huge, huge role. And sometimes, but not often, we do a biopsy. That's only if we're totally baffled by what we're seeing, which doesn't happen often, I'm proud to say. But there are indications, particularly in scarring alopecia, where a biopsy can be very helpful. Without doing this thorough examination, the treatment, it cannot be properly put together. It's so important that we know what's going on before deciding what kind of treatment. It's not the same treatment for everybody. Each individual gets their treatment plan individualized to their needs and to their wishes. Everybody's different. And so all of that plays a role into how we treat patients. Okay, so before Sarah starts the discussion about minoxidil, I just want to say that, again, as I said in the beginning, some of you might not have been on, but I think minoxidil is one of the most misunderstood and least utilized treatments for hair loss, and for women especially. There's a lot of information out there. There are a lot of products that claim to regrow hair, but unless they have minoxidil in them, they're not going to regrow your hair. So I think it's been around a long time. I think in general, women's hair loss hasn't had much press. Not a lot of people have talked about it until probably the last 10 years. So what does minoxidil, what role does that play in treating women's hair loss? It can play a huge role in conjunction with other treatments as well as by itself. So I'm going to have Sarah take over from now, and then I'll pick up at the end with questions, and hopefully we'll be able to get to all of your questions. But in any case, I'm going to turn this over to Sarah.
Thank you, Dr. Wendell. So I'm Sarah. For those of you who don't know me, I'm one of the nurse practitioners here, and we will talk a little bit next about the history of minoxidil. So minoxidil was originally formulated as an oral medication for hypertension or high blood pressure. So it's a known vasodilator. So it essentially dilates the blood vessels, which in turn would decrease someone's blood pressure. And kind of what they had noticed during some clinical trials back in the 1960s, they noticed that increased hair growth was a side effect from people actually taking the medication. So it was believed that about 60 to 80% of patients were actually showing that they were having some hair growth. And then in the late 1970s, a topical form of minoxidil was created and in clinical trials formed to study its effectiveness as a hair loss medication. So then later in 1988, there was a 2% strength prescription minoxidil that became available for men only. And then in 1991, a few years later, it became available for women. Later, too, they upped the percentage. So in 1993, a 5% strength became available. And currently, right now, minoxidil is the only FDA-approved topical treatment for hair loss, which is primarily recommended for women with androgenic alopecia or female pattern hair loss that Dr. Wendell had mentioned earlier. So this is a slide kind of describing how minoxidil works. It is topically applied to the scalp. You know, the complete mechanism of how minoxidil actually helps to treat hair loss is not fully understood, not fully confirmed via studies at this time, but research has been ongoing for this for many years. As I mentioned before, it's a vasodilator, so it actually widens the blood vessels, so it increases blood flow to that area. It is believed that the increased blood flow is one of the reasons how minoxidil helps to slow down the hair loss and actually regrow hair. Recent studies out there have shown that minoxidil increases cell proliferation, including the hair follicle cells, so meaning the turnover and cell growth. So just in continuation of the previous slide, we know that this increased blood flow helps to increase nutrients to the hair follicle, and it helps increase growth in the anagen phase of the follicle, which Dr. Wendell had mentioned at one of the first slides. And a big treatment is to focus on treating the hair in that anagen or growth phase. So the benefits of minoxidil are, number one, to stop the hair loss from getting any worse, to thicken any of those existing miniaturized hairs. So if you see kind of in the middle photo of this diagram, it shows shrinking follicles, which will give you thinner hairs in turn. So the minoxidil does help to thicken those miniaturized hairs, we call them. And then also can help to increase follicle size with a greater percentage of follicles in that actual anagen or growth phase. So we do know that it increases vascular cell growth by up to 6%, which results in a better vascular supply, not simply just vasodilation. And this was done in a review in 2019 by the National Institute of Health. With anything with hair, it takes up to 6 to 12 months to see visible results. So, you know, consistent use nightly of minoxidil is what it takes to see these improvements. So this kind of talks about how minoxidil has changed over the years. As I mentioned before, it is, you know, originally was a 2% formulation, and that was only recommended for men at the time. And then it came out for women a little bit later. And initially, it was a prescription only for men, but then became available over the counter as what everyone probably knows as Rogain. That was in 1996. It is now available in a 5% concentration. So we've been seeing kind of increased strengths of minoxidil. And again, originally for men, but later studies have shown that women should be on a 5% minoxidil as well. There is a foam. You know, one of the biggest complaints of over-the-counter Rogain or minoxidil is that it's greasy and it's irritating to the scalp. The foam was considered less greasy and easier to apply. The foam just needs to be applied a little bit carefully. You know, if as any hair product, if it's not absorbed into, you know, it's absorbed into the actual hair and not the scalp, you're not going to be getting the full benefit. You really want to make sure you're applying it to the scalp and it's not being absorbed by the hair. And then the minoxidil foam doesn't have a propylene glycol, so it was less irritating to the scalp. So minoxidil today, it's originally still sold as Rogain, which is the generic form of minoxidil. It's in a lot of products these days. Many online companies sell these generic minoxidil that doesn't contain any other active ingredients. Typically in these formulations, it's a 2%. Companies like Keranique sell hair growth products that have a 2% minoxidil. There are over-the-counter and prescription formulations. Many products, both over the counter and prescription, that include a 5% minoxidil give other active ingredients, and other active ingredients in these formulations help to decrease inflammation and increase absorption. We don't really recommend oral minoxidil, especially in an active or chronic telogen effluvium state, which is an increased hair shedding phase. Only with a doctor's permission would we do that. So what do you want to look for in a minoxidil product? So you want to make sure that it's a 5% strength. It's proven by studies to be much more effective than the 2%. You want to make sure there's ingredients to decrease irritation and inflammation. Anything that has a mild steroid or a natural anti-inflammatory. Things that help to increase absorption of the actual product. So you want to find something that has something in it like a retinol or tretinoin is they're known ingredients that help increase absorption. So you're going to get more of the minoxidil into the scalp. And we recommend a 5% minoxidil without propylene glycol, with a mild anti-inflammatory, and with retinol to increase absorption. And that's what our product here is, the Formula PM. This is our recommended minoxidil product that we carry here in the office. So who should use minoxidil? Anyone with an androgenic alopecia or female pattern hair loss that Dr. Wendell had described in one of the early slides. It's approved by the FDA for only androgenic alopecia, but it's has many off-label uses, meaning not actually approved by the FDA, but have been shown to improve hair growth in these following diagnoses. So alopecia areata, if men are looking to enhance facial hair, beard growth, scarring alopecias, CCCA and FFA, any chemotherapy-induced alopecia. It can be used on the eyebrows to help grow eyebrows, and then a telogen effluvium once in recovery. So these kind of just give the off-label uses with proof that they do provide benefit here. So a big thing is combination therapy. The more you do to your hair to improve growth, the better results you're going to have. So we strongly recommend combining treatments in many ways. So we will often pair minoxidil with combinations of other things that we offer here in the office, including optimal platelet concentration or OPC, platelet-rich plasma therapy or PRP, the low-level laser therapy, and then our supplements and vitamins as well. So a lot of studies out there show the importance of combining these therapies. In 2020, there was a study done on PRP and minoxidil that combined both the use of the PRP injections and topical minoxidil. And this showed a significant improvement in the hair density, diameter, less shedding, less telogen or miniaturized hairs in combination with the combination treatment over one of these alone. Also in 2017, there was a study done on the low-level laser therapy in minoxidil, and this group used both low laser therapy as well as minoxidil, had a significant improvement in the aforementioned things, hair density, hair diameter, less shedding, than either group's just using laser alone or minoxidil alone. So like I said, the more you do, the better results you'll have. So side effects of the topical minoxidil. Kind of one of the big things that I see here is we ask when people come in for consultations, have you tried minoxidil before? And a lot of people will say, yes, it didn't work. But really, in reality, people didn't really give it enough time and enough of a chance. You know, there are some reports that there is an actual increase in shedding when you start minoxidil, and that has happened before, but there have been a lot of studies that have shown the regrowth in 6 months far exceeds the little bit of shedding that happens in the first few weeks of using minoxidil. So a lot of people will totally steer away from it because they have a little initial shedding, which can be scary, of course, but anything with hair, any of the treatments we talk about here, the big things are consistent use over time to get the results you're looking for. So Some of the big side effects people will say, you know, it's causing your scalp to feel a little irritated in the sense of itchy, drying. That's typically with the over-the-counter Rogaines that have a lot of alcohol content. Like I mentioned, you know, anything over the counter that have that propylene glycol. And if that is a problem, you can use a foam that's a little bit less irritating to the scalp. There's no propylene glycol, or our formula PM that we have here in the office has very, very minimal alcohol content. Some people will complain of excessive facial hair. You know, if this is something that bothers you over kind of the regrowth of the hair, you know, you can always wax laser. A lot of people are doing dermaplaning these days anyway. So it's always an option to remove that unwanted facial hair. If, you know, this is something that really significantly bothers you and you don't want to bother with those things, you can just stop using the minoxidil. You know, it's rarely like intolerable in the sense of the irritation or the hair growth on the face. And again, it's completely reversible. So minimal shedding in the first month, like I had mentioned before, this is far outweighs, you know, it's far less shedding with the initial use of minoxidil than you would have in terms of regrowth 6 months later. The minoxidil itself needs to be tapered off if it's something you want to come off of, or for example, really only women with androgenic alopecia who shouldn't be on it are pregnant women or breastfeeding. So we would need to taper it off in those cases because stopping it suddenly can cause increase in shedding. However, you know, loss of any of that new growth would return in 2 to 4 months. And then you need to make sure you taper it off in these situations. If it's something you want to stop, you wouldn't just want to stop it outright. The big thing really, like I mentioned, is consistency is key. So you want to make sure that you're using it every night, using as directed. I know there's a lot of questions surrounding minoxidil, so I'm going to turn it back over to Dr. Wendell, who can answer any of these questions for you. Just mute myself.
Muted. Sorry about that. Thank you, Sarah. One of the things that we didn't mention, and I'll just bring up briefly, is with certain types of minoxidil products, we can add other products to it. It gets to be, again, this is where we can really individualize therapy. So we do, in some instances, recommend adding some other medicines to the minoxidil to get benefit depending on the individual and their problems. Okay, so I'm going to go to the questions. Okay, somebody asked, Stephanie asked, if hair will regrow after Mohs surgery using minoxidil. The answer to that question is it should. I can't honestly say that I have seen anybody in that instance, but Mohs surgery does not, it shouldn't destroy the hair follicle. Any type of procedure irritating can cause hair to fall out, but the type of Mohs surgery that I know about in terms of treating skin cancers should not destroy the hair follicle. So it may very well help with regrowth. Again, I would have to examine somebody personally before making a decision as to whether I thought it would help or not, but it shouldn't scar the skin. Mohs surgery is a very delicate procedure to treat skin cancers, and they're very careful and has limited scarring. That's one of the good things about Mohs surgery is there's limited scarring. Is scarring from relaxers scarring? Yes, scarring alopecia. One of the most common causes of scarring alopecia, sadly, is chemical treatments to the hair, whether it's relaxers or perms. Some of the harsher chemicals that are used for straightening hair can cause scarring alopecia. It doesn't happen right away. It can take several years, many years, in fact, for it to become obvious to us. But yes, unfortunately, that is exactly what scarring alopecia can come from, is from relaxers. That's not the only cause of scarring alopecias, but it is one of them. Okay. Somebody asked, traction alopecia was not listed as part of the hair loss that minoxidil can help treat. Is it because it is not recommended for this type of hair loss? Actually, that's a really good question, and that's something we should have been a little bit clearer on. Traction alopecia, particularly if it's diagnosed early enough, can respond to minoxidil. Traction alopecia is really a spectrum. It's caused by pulling the hair really tightly. We see it very commonly in the front, and literally the pulling or the traction on the hair follicle causes the hair to fall out. And scarring can take place. It takes a while for that to happen. So if we meet with a woman who's got scarring alopecia, particularly in the front, it's always important to try minoxidil right away, because some of those hair follicles are probably still able to be stimulated to come back and grow. So that's a great question, and I'm sorry we left that out. So the answer to your question is yes, it can help. The other things can help along with it, including PRP and laser, but very important to try minoxidil the minute you start to see any loss of hair, particularly in the temples and right in the front from traction alopecia. Okay, that was a great question. So, somebody asked, can you advise how much your formula PM costs? You're currently on 82M. They're similar. We used to recommend 82M. Unfortunately, there were some issues with the company, and that was one of the reasons why we stopped providing 82M. So they're very similar products. We just felt that our product offered some safety that the 82M wasn't able to do. We had some issues with the formulation, and so we moved away from it most recently, but they're comparable. Somebody asked if you temporarily stopped using minoxidil because of a medical procedure done in the hospital, how would you handle that process? You can miss quite a few doses of minoxidil before worrying about the shedding that can occur from stopping abruptly. If you're in the hospital for a few days, even a week or two, it's not going to make a huge difference. You know, you can miss it. It's not going to be a huge problem. When you get home and you're feeling better, just go ahead and start it back up again. What we tend to see is because women especially are very conscious of, is this working or not? And it's very hard to see visibly what's going on at a microscopic level. And initially, in the first 6 months of using minoxidil, it really occurs at the microscopic level. If we were to measure your hair, the numbers of hairs prior to starting minoxidil, and then 6 months later, we would see better quality hairs and more of them in 6 months. Unfortunately, it's very hard to see that in those first few months, which is why people give up on it quickly. So if you've been using minoxidil for only a few months and for whatever reason decide you don't want to, if you stop it, you're not going to see a huge loss or shedding. But what tends to happen is women who've been using it for years, for whatever reason, decide they don't want to do it anymore, and they stop it abruptly, and then they're back in the office in 6 months because their hair is just shedding profusely. That's really sad for me to see, because minoxidil, you know, a lot of people say, I don't want to put anything in my hair. It's messy. It's too time consuming. Well, I will tell you, I've been using minoxidil for 10 years or more, actually. You know, it takes 5 seconds to do it. I do it in the evening before I go to bed. You know, you just apply it, just kind of rub it around, wash your hands, and go to bed. It takes me less time to put minoxidil in than it does to brush my teeth. And does it leave a little bit of residue? A little bit, but not so much that you absolutely have to wash your hair every day. So it fits in very nicely with most people's schedules if they just keep an open mind. And as Sarah had talked about, the combination therapies, minoxidil helps to make the PRP and OPC work better. It helps to make the laser therapy work better. It can be a standalone therapy. I've seen many women use it and have good results from it alone. We tend to recommend combination therapies because they work better. But I would tell you that it's something that everybody should consider who's experiencing hair loss. Question, is it once a day for women? Yes, it is. There are some studies that are being done comparing twice a day to once a day, but honestly, most of the studies are once a day. I think once you start using it twice a day, it does become less convenient, but it is once a day. Again, applying the minoxidil, as I said, most of them come with a dropper, some kind of dropper. And I literally just drop a little bit on 3 different lines from the front to back, kind of rub it in, wash my hair, and I'm done. It's very simple. The foam is a little trickier because, as Sarah mentioned, you have to get the foam onto the scalp. If it sticks to the hair like styling foam, it's not going, some of it will drip down eventually, but it really needs to get to the scalp. So to use the foam, you have to part your hair, kind of dab it along different areas. It's still generally the same process. It just takes a little bit longer time. Can you use it every other day? I will tell you that all of the studies are daily. I have not seen a study that compares every other day use to daily. So I can't recommend every other day use. If you miss it once in a while, not a big deal. But it should be, you should try to do it every day. Eyebrows. Again, eyebrows, you have to be careful because you don't want it to drip into the eyes. So again, you'd probably want to use like a towel or tissue, and then just a little bit of drips onto the eyebrow, kind of massage it in, just, and then wash your hands. But I would use some kind of protection, whether it's a towel or a tissue. You could apply it with a Q-tip, but some of that might get absorbed to the Q-tip, but it has to be done carefully. And it's not the same amount. You don't put the same amount on your eyebrows as recommended for the scalp. So it would probably be maybe 4 or 5 small drops on each eyebrow. Careful not to let it drip. Yes, next question, should it be used every night, even if she doesn't wash her hair every morning? Yes, it can. The over-the-counter formulations, unfortunately, are really sticky and leave a fair amount of residue on the hair. And so it's tough if you don't wash your hair every day. The higher quality formulations like the Formula PM leave significantly less on the hair. So it's not so much of an issue. I don't wash my hair every day, but I use the Formula PM every night. Is Medi Tresse's product less greasy than others? It's certainly less greasy than the over-the-counter, absolutely. Somebody said their dermatologist told them that minoxidil would stop shedding, but would not stimulate hair growth. How would I address this? I would say it's not true. It will help stop shedding, but again, it does stimulate hair to grow. Is it something that everybody sees in the mirror within the next few months? No. But there's no question that there have been hundreds of studies done with minoxidil that show improved growth, prolonged growth phase, that anagen phase, bigger hair follicles. It takes time though. And is it going to be that huge wow change where, in December, you're looking at where your hair is thinning and you're putting the minoxidil, and 6 months later, everything looks back to normal? Absolutely not. Nothing's going to get you back to normal, but it will help grow hair. It's absolutely worth using it. And this is one of the misconceptions, I think, about minoxidil. So that, there's no question that it will help to regrow hair. I've seen it. What are my thoughts on special shampoos and vitamins along with minoxidil? To be honest with you, there's no shampoo product that's going to help regrow hair. Shampoo products really are meant to make your hair look fuller, to style easier, to condition. Conditioning is very important because a lot of what we do to our hair, even people who aren't losing hair, a lot of what women do to their hair dries their hair out terribly. So shampoos, conditioners are really meant for styling and for conditioning. Vitamins can make a difference in terms of strengthening hair. We do recommend supplements. We do have them. We offer our own Tresse supplements. We do think it's important. Studies have shown that it does help the hair to be a little bit stronger. So again, special shampoos, don't expect any shampoo to help you regrow hair. Shampoos are meant for styling and conditioning, which is incredibly important. Somebody said, you said with scarring alopecia, it's an autoimmune disease and can be very aggressive. Do you mean the immune disorder can be aggressive or the hair loss can be aggressive? It's really the hair loss. It can be very rapid hair loss. We can see women coming in the matter of a few months having significant hair loss from scarring alopecia. It's a rapidly inflammatory disease. It doesn't happen quickly with everybody, but it can. So again, one of the reasons why somebody is experiencing excessive shedding or they're starting to see areas where the hair is thinning, the sooner you get treatment and getting the proper diagnosis and then therefore the right treatment, the better chance you're going to save hair. With scarring alopecia, if people wait too long, we can't bring those hairs back because it literally scars the hair follicle. Unlike androgenic alopecia and some of the others like traction, and even alopecia areata, those hair follicles aren't destroyed. You can pull them back. With scarring alopecia, you have a time limit. The sooner you get treatment going, the more hair follicles we can save. Okay, somebody asked, does minoxidil work on the sides of the scalp as well as the top? The answer is yes. The minoxidil can work anywhere, but the studies primarily have looked mostly here and back here. Nobody really does much studies in terms of here. So the hair counting and observation has mostly been in the front, but it does, a little bit of it gets absorbed. So clearly you can't put minoxidil on your entire scalp. If you do, you're using way too much. So a little bit gets absorbed. So, but still you want to put it primarily where you're seeing the thinning, and a little bit will drip down, but a little bit gets absorbed. So it will actually help treat all of your hair. It's one of the reasons why people can get a little bit of facial hair growth. It's not from dripping onto the face. It's not from getting on your pillow. It's because a little bit of it gets absorbed, enough to stimulate these hair follicles. Not every hair follicle in our body gets stimulated by minoxidil. That's the other thing that's interesting. It doesn't affect all hair follicles the same, but it does affect the hair follicles on the face and as well as the scalp, mostly the scalp, but a little bit on the face. The other thing that's interesting, and this may account for why not everybody gets the same kind of response. I read a study recently that showed that for some reason, because of our genetic makeup and our own personal biochemistry, not every medicine works equally for everybody. And that includes all types of medications, whether it's for diabetes, hypertension, whatever. Not everybody responds the same, and it's because of our body's biochemistry. And it appears with minoxidil, there's actually two types of people that respond really, really well and people that don't respond as well. Doesn't mean you can't, but you're not going to have the big response that other people have. And I've seen that. We always ask ourselves, why did this person do as great when this one didn't do quite as great? And I think a lot of it is how we're made up, what our own personal biochemical makeup is. And that was demonstrated in a study that was done. So in terms of minoxidil, yes, it was found that it helped everybody pretty much. I mean, on order of 90% or better, but it doesn't affect everybody equally. But that doesn't mean that it shouldn't be used. And again, as Sarah had said, it should be considered as part of your entire treatment plan. It helps the laser work better. It helps the PRP work better. And for some women, the minoxidil alone is all they need. And I've seen that. And when it happens, everybody's happy. But again, some people, it takes a little bit more effort to get that regrowth. It will pretty much help everybody, but not to the same degree. Somebody asked me, what do I recommend? I recommend 5% minoxidil for any woman experiencing androgenic alopecia. The formulation that we have does have a mild anti-inflammatory, so it doesn't irritate the scalp. It also has a little bit of tretinoin, which is like a retinol, which does help it get absorbed better, and it's less greasy. For some people, they come to us, they've already started over-the-counter minoxidil. And I give them all their options and explain if the over-the-counter is not irritating their scalp and they're happy with what they're seeing, there's probably not a huge need to change, but I do let them know that these other products might actually work a little bit better. It's very individualized, but I do think that the product that we have, the Formula PM, is an excellent product. I use it every night. Somebody's looking for instructions on how to apply. Hopefully I've touched base on that. Yes, it will drip a little bit, but so again, you need to be careful and sort of put it where you're most interested in having it work, which for most women is like right here. And it will drip down, which is, just kind of rub it around. That's what I do. And then just carefully wash your hands when you're done. It really, yes, you'll feel a little bit of it drip down. It's funny, I changed one formulation from something that had a squeeze bottle to something that had a measuring dropper. And you were supposed to use the same amount for each one. And I was using the squeeze one for a couple of years, and I thought I was getting enough on. But when I finally used the dropper, which had a measuring line, I realized that I wasn't using enough for quite a long time. So yes, if you're using enough, you're going to have a little bit of dripping, but just rub it in and wash your hands. It's fine. What happens if you're already on medication for hypertension? Will the minoxidil lower the blood pressure? No. I'm laughing because I have borderline blood pressure and I keep thinking my minoxidil will keep it down, but it doesn't. Not enough of it gets absorbed. It's very, very minuscule amounts get absorbed. So it's not going to affect your blood pressure at all. It was a great blood pressure medication when we used it for that, but no, taken as a topical treatment, it doesn't really affect blood pressure at all. But as you know, for someone who has hypertension, I would let your doctor know. Again, I don't think they're going to be the least bit concerned. I did primary care for 30 years. It wouldn't have concerned me at all. Okay, somebody asked about application. Again, obviously this is a concern and I'm glad people are asking it. Again, I prefer one that has a dropper so you can actually control the amount that's coming out, So I literally, my hair thinning is in the front and I literally do it in the middle, just drops all the way down, on the sides all the way down, and then on this side all the way down. And a little bit will drip down and that's fine. Rubbing it in carefully for a few seconds and you're done. The difference between formula 82M and formula PM, the only difference is that the 82M has a stronger anti-inflammatory. It has a little bit of a steroid in it. Our formula PM has a more natural anti-inflammatory, which works well. That's the only difference between the two. Is the hair growth light and fuzzy? And can it happen if she's very careful and don't get the product on your face, or if I wash it off immediately from the face? The hair, I assume you're, in terms of the hair growth light and fuzzy, you're referring if it grows on the face. What I tend to see is you just get a little bit more fuzziness, that sort of whitish peach fuzz kind of growth, which a lot of women get even without minoxidil. You can get a little bit of thickening just above the eyebrow and maybe a little bit of thickening, but it's extremely minimal. And again, it's not because it drips on your face. And that's sort of a misunderstanding that gets passed along. It's really because a little bit of it gets absorbed. It's minuscule, but it's enough. These particular hair follicles on the face, it's enough that it can stimulate in some sensitive people. As I said, there are two types of people, some people that are very sensitive to it and some people that are less. What I tell my patients is if you're noticing a little bit of growth on your face, if it's white and it's peach fuzz, you can get it microplaned, no big deal. But the other thing to remember, and I tell them this, if you're getting a little bit here, you're getting some here. And so I don't see it as necessarily a bad thing. I probably have a little bit more peach fuzz, I get it microplaned. Keeping my hair thick here is more important than having to deal with a little bit of peach fuzz down here. Somebody bought over-the-counter Rogain at a dermatologist's recommendation and read the label. It said, do not use unless your hair loss is at the crown of your head. Yeah, this is also a terrible misunderstanding. And I don't know why they have this, because when it first came out for men, that was the recommendation for men. And in a lot of things in medicine, the recommendations for women are not changed. And so for men, what they noticed was the biggest response was back here. And so men were literally putting all of their minoxidil back here. I will tell you that I see women get thickening here in the temples, get thickening here. Men and women's hair loss is not the same. It's different. And women respond differently to treatments than men. So I see this a lot, and it makes me sad because there are so many reasons why people decide not to use minoxidil, and this is misinformation that you were given. And unfortunately, again, it's on in the insert, the prescription insert. It has all these it has all these recommendations, but that's a mistake. I would tell you, forget it and forget what that said and to use it, because I think it has benefit. Let's see. We're going to go for another 10 minutes. There's a lot of questions, and I'm not probably going to get to all of them, but I will do my best. But again, I want to say that if I don't get to your question, when we send out the email and you can click and send us a message, we will answer those questions for you. Oh my goodness. So this person said they used minoxidil for 3 months and grew a very dark beard and stopped. So she's terrified to restart it. I've never seen that. I shouldn't say that. I saw one woman who got profound regrowth from it, and also had a little bit of growth above her eyebrows. You know, you have to decide. You have to decide, is it worth it to you? And if you got profound facial hair growth from it that was very bothersome to you, I would, you know, you have to decide if it's worth getting it lasered off or waxed, so that you can continue to use it up here. Again, most women who will notice a little bit of peach fuzz are getting a response here. So it's, you know, you have to decide, is it worth it? And I think most likely you were getting probably a decent response on the top. In just 3 months to have experienced that much facial hair is extremely rare, But I'm not going to tell you that it doesn't happen. Obviously, it can. Well, and the other part of the question is, will the new hair grow as long? As you know, as I mentioned earlier, and as Sarah mentioned, with genetic hair thinning, the hairs tend to get smaller over time. And so they don't grow as long and they're not as thick. What minoxidil does is it tries to get them to grow better. And so the goal is eventually in time, and it may take 6 to 9 months for this to transition, the hair should start to be a better quality hair. So I hear you when you say you're afraid to lose what you have. You won't lose, when you stop minoxidil, you only lose the amount of hair that you gained from using it. You won't lose more than that. So I hope that's clear for you. So if I use minoxidil for 6 months, 12 months, and I've gained a little bit, but for whatever reason, I've decided I can't use it anymore, I will lose what I have gained from the minoxidil. I should not lose more than that. So I would be happy to speak with you. Your situation is extremely rare and unusual, but I would be happy to speak to you if you would like to email us, and I can address that with you personally. Yeah, somebody again asked how often you use it. It's daily, nightly. I generally recommend nightly. Are there any medical conditions aside from pregnancy that preclude someone from using minoxidil, heart problems, etc.? 99% of the time, I will say no. As we age, our bodies become more sensitive. There is a list of potential side effects to minoxidil. One of them is headaches. If you're someone who has migraines, I've had patients whose migraines have gotten worse from minoxidil. As a vasodilator, it will aggravate headaches in some individuals. I have migraines. Do I think it bothers mine? Not really, but I'm lucky in that regard. I've had many patients for whom it has. The other side effects can be a palpitation. Again, so little of it gets absorbed. Is it possible? Yes, it's possible, but it's extremely unusual. I think in the 10 or 15 years since I've been seeing female hair loss patients, I've had 1 or 2 patients who I thought might have had some palpitations as a result of it. We recommended that they stop it, and it went away. So it's extremely unusual. It certainly tends to happen in older individuals. The 2 women that I told to stop it, both of them were much in the older age groups, 75 or higher. So it can happen, again, not that common, but we are more sensitive to those issues in older women. Somebody asked, our replacement for 82M is the formula PM that we have, which is basically the same other than it doesn't have the cortisone in it. It has more of a natural anti-inflammatory. Is minoxidil a good treatment for scarring alopecia? Minoxidil can be used for scarring alopecia, but it will never completely treat scarring alopecia. Scarring alopecia has to be treated very aggressively. Minoxidil can be a part of that, but minoxidil can never be a solitary treatment for scarring alopecia. Once the hair follicles are destroyed, they cannot be brought back. So scarring alopecia treatment has to be aggressive in terms of decreasing the inflammation. And if the inflammation is under better control, then minoxidil can stimulate some of those hair follicles that haven't quite yet been destroyed. It will help them to grow again. But again, for scarring alopecia, the focus initially is on getting the inflammation under control. Okay, I think I've answered some of these. Oh, my minoxidil bottle says not to leave it on for more than 10 hours. Can you talk about why this is, and should you wash it out after 10 hours? Is there any danger in leaving it on? No, because it stops getting absorbed in about 6 hours. So they're really, I don't know why that's on there. We've talked to some of the companies as to why they have it there. I don't know why, because again, it stops getting absorbed fairly quickly. What type of hair grows from using minoxidil, PRP, and low-level therapy? Would hair be gray if you have gray hair? Yes, it grows whatever your natural color hair is. And it will stimulate hair that you naturally have to grow better. And it will improve some of those hair follicles that are under stress to grow a better quality hair. But if your hair is naturally gray, it will be gray. Doesn't mean you can't dye it if you choose to, but it will come in gray. Thank you. Some people just clarifying questions. Do you have to use minoxidil for the remainder of your life? That's really a good question. She's using nioxin products, and is she wasting her money? Minoxidil only works while you use it. I tell patients that if they want to be serious about their hair loss, they need to use it as long as they care, or until something better comes along. And there are better treatments, but again, we know combination therapy works best. Is minoxidil for everybody? You know, even after I tell my patients that, some patients will say, I don't want to use it. And that's okay. They understand, they've been educated, we tell them, and they just, you know, decide to do the other treatments and not the minoxidil. So nioxin is a good product for quality hair. It's not going to regrow your hair. It's going to make your hair stronger that you have, but it's not going to regrow your hair. So there are products out there. I don't know if nioxin yet has a minoxidil product. Some of them will now have a packaged product like Keranique, where it's a shampoo, it's a conditioner, and it has a serum. And if you read the label carefully on the serum, a lot of those will have minoxidil in it. It's just a more expensive formulation. I don't think you gain anything by using those. And a lot of them are 2% that you have to use twice a day, which makes it less useful in my opinion. So I hope that answers your question. This next question is just reaffirming what I said before. When you stop using minoxidil, you lose the regrowth that you got from it. You don't lose the other hair that was already there before you started using it, but whatever you've gained from minoxidil, you will lose. And it happens kind of fast, which is kind of scary. You stopped minoxidil a month ago. Will it shed a lot now that I need to restart it? No, it shouldn't. Again, when you start minoxidil, you'll notice that doesn't happen with everybody. You might notice a little bit of shedding for the first week or so, couple of weeks. Again, important to remember, we know that yes, that can happen, but in 6 months, whatever little bit you've lost, you're going to regain and then more within a 6-month time frame. So what happens with that the beginning of shedding is because what it's doing is kicking out hair follicles that are about ready to fall out over the next month anyway, just making it happen faster. But then the minoxidil will stimulate those hair follicles to regrow a hair back faster. So yes, it kicks it out a little bit faster, but it regrows faster and it's a better quality hair. Is using low-level laser cap right after applying minoxidil helpful? This is a great question. No. In fact, you want your hair to be dry when you use the laser. You don't want any moisture on your hair, so or on the scalp. The light has to get to the hair follicle, and if anything's in the way. So for myself, I use the laser every other day or so, and so I do not put the minoxidil on just before I use the laser. It's not a good idea. It won't hurt you. The laser won't get to where it needs to go. Somebody asked, they have a laser and got PRP. Should she use minoxidil also? I think so. I just, studies have shown combination therapy works better. If you got a good result, that's great. But I still think any woman with genetic hair thinning should be on minoxidil. That's my bias. That's what I do. And I've been doing it for a long time. And I use laser as well. How often you need to wash your hair in terms of using minoxidil? It's up to you. Again, I put the minoxidil on at night. I wash my hair every 2 to 3 days in the morning. You don't have to wash it more often. Somebody asked, if you're putting minoxidil on areas that don't have hair loss, if you stop putting it on those areas, will the hair fall out? No. Again, as I stated, when you use minoxidil and you get some regrowth, if you stop it, those are the areas that are going to shed, not the areas that were fine to begin with. Somebody asked about how much do you use? It should be on the bottle. Things with a dropper, you pull it up to that dropper line. I know the 82M, it was supposed to be 20 drops, I believe. It's kind of hard to count that, but it's important to get enough. It's important to not get too much either, but it is important to get enough. Does not have to be applied at night, whatever's most convenient for you, once a day. Somebody asked about hair loss on the sides. Yeah, again, if you want to focus on those areas where your hair is thinnest, understanding that a little bit will drip around, and that's enough. It's enough. Again, focusing on the areas that you want treatment the most is where you put it. It will drip a little bit, but you want to spread it around. Somebody's saying they struggle with chronic telogen effluvium and androgenic alopecia. Would you recommend minoxidil use or stay away? I actually would recommend use. If you have underlying androgenic alopecia, you should be on minoxidil. Chronic TEs sometimes do respond to minoxidil. When someone's in a brief telogen effluvium, like postpartum or from an illness, you don't generally need the minoxidil. But for chronic telogen effluvium and androgenic alopecia, I would say you should be on it. Okay, we're going to go for just another couple of questions, and then unfortunately, I will please send your questions to the email that will be sent to you. How many studies show that you can become desensitized to it over time? I don't see any, to be honest with you. I think but I will tell you, in all treatments, I don't care what treatment you use. We do know combination treatments work better than single treatments, but you get a benefit to say this, you start here, your benefit brings you here. Virtually all treatments for androgenic alopecia, whether it's PRP, laser light, minoxidil, you reach a plateau. Treatment can get you to a certain point. There's nothing that's going to regrow all your hair to what you had 20 years ago. There's nothing that's going to do that. So you will get benefit from here to here, and it will plateau. If you stop your treatment, you'll go back down. So yes, I guess maybe it's not really desensitizing. It's just that you've reached your maximal benefit. It's not going to keep getting better and better and better and better. One study that I saw was using lasers plus minoxidil, and they felt that people kind of plateaued after 2 to 3 years and kind of stayed there. Again, it's not because it's desensitized. It's just only so much that these treatments can do. But that's a benefit you get you go from here to here in 2 years, 2 to 3 years, and with treatment and continued treatment, you're very likely to stay there. Yeah, scarring alopecia, again, a tough one. The inflammation has to get under control. Minoxidil won't do that. Minoxidil will help regrow, but it won't get the inflammation under control. Deep dermaplaning and waxing. Dermaplaning is like it's a very small blade, which actually does a little bit of, it takes the hairs off. It also takes the top layer of skin. It's not harsh, it's very mild. And so you get a little bit of dermabrasion from it. So it's a combination of dermabrasion and a little bit of removal of that hair. And so by removing the top layer, very top layer of skin, takes off the dry, dead skin, you get a nice glow from that. So it offers some benefit. Waxing, I think we all know what waxing is. You put the hot wax on, they yank it off. It's pretty traumatic. Dermaplaning, you'd need to do it like once a month or so. You can go someplace and get the dermaplaning done, or you can purchase your own unit. I bought my own, and I do it every 1 to 2 months. And it does take care of my peach fuzz, and it does also take all the dead skin off of my face and hopefully let the new skin show through. Okay, I feel terrible not answering all these questions. Somebody asked, can you use minoxidil on wet hair? Absolutely. Oh, good question. Will a hair transplant help better than minoxidil and other therapies? Would hair transplant be the gold standard for helping with hair loss? That's a really big question. Hair transplant's not for everybody. There are fewer women that are good candidates for transplant than men, but there are women who are good transplants for men. We've had many of our patients, female patients, get hair transplant. But it's very individualized. You have to have good donor hair. And if that's something you have a question about, it would need to be evaluated. We do have a hair transplant surgeon who works with us now. So we do offer that treatment as well. So that if you wanted to be evaluated for that, we could do that for you. Minoxidil, they work very differently. It's like comparing apples and oranges. It's two different types of treatment. One cannot do better than the other. It would really involve treatment. And if you had a hair transplant, we would recommend minoxidil with it. So anyway, I don't know that answers your question, but it would need an in-person evaluation and an evaluation by a surgeon who does hair transplants, which we have now. We have Dr. DiStefano. So thank you for that question. Last one, and then I've got to stop. Dermatologists prescribe spironolactone, minoxidil, or finasteride. Depending on your age, spironolactone, most of them do not recommend oral minoxidil. I have not seen a dermatologist yet who does, and finasteride. Finasteride cannot be used for women who are premenopausal, only postmenopausal. So sometimes we have patients who are on spironolactone, who are using topical minoxidil and on finasteride. But again, it's age dependent and the type of hair loss that you have, and would require follow-up treatments with with whoever's managing your hair loss. So again, all those things can work, and they can work together on the right patient. So again, I want to thank you all. I'm sorry I didn't get to all the questions. This is obviously a topic of great interest. And as I said before, I think there's a lot of misinformation. I feel very strongly, I can't say this enough, any woman with genetic hair thinning should be on minoxidil. Not everybody is for a lot of different reasons, but everybody should consider it. And I can't emphasize that enough. And I just use myself as the example. I've been on it for over a decade, and I'm terrified to stop it. I don't want to. So I plan on staying on it until something better comes along. And so far, you know, I still think that laser and PRP are absolutely important treatments, but minoxidil needs and should be there. We know that patients that use combination therapy, the most they do, including supplements, which I use, the more you do, the better your result. And research has proven this. So thank you all for coming. I just want to let you know that our webinar series is continuing. Next week, we're actually have a very timely discussion. Next Wednesday on shedding and hair loss in the year of the pandemic. We've seen a lot of it, and the reasons for that will be discussed and what could be done about it. And then in 2 weeks, we will revisit low light level laser therapy, which is very important in treatment of genetic and other types of hair loss, including alopecia areata and in some cases scarring, again, depending on the individual. So thank you all for coming. I apologize that I didn't get to all these many questions, and hopefully we'll see you soon. But if you have any questions and would like to speak to me or any of our practitioners, please answer the email that will be sent out to you after this. So thank you again for joining us.